So I would like to introduce myself. As Madam already informed that I have completed my PhD in nursing from Himalayan University in the year of 2019. And I have more than 22 years of experience in the field of nursing, especially College of Nursing for the student nurses and also as well as the clinical staff nurses. So since 2007, I have moved from India to abroad. Almost 17 years I'm living here in Saudi Arabia, working under Ministry of Higher Education and also Ministry of Health. So this is about me, and also, as Madam told, my bachelor degree is from Sri Balaji College of Nursing from Chennai, and also my master degree is from Adiparasati College of Nursing from Mel Maruthur in the year of 2004. So, on the whole, I have 22 years of experience in the nursing field for the College of Nursing as well as the clinical nursing field. Currently, I am working as a, this is our institution. You can able to see this is one of the largest institution in Saudi Arabia. So we have more than 1500 bedded hospital with all specialty. We used to say King Saud Medical City. As all of you know that when you go to a city, so you will find everything, you can buy everything. Same like here, we used to say King Saud Medical City. It is a city, so all the specialty, if you found, if you come here, you can find all type of specialty, where whatever the treatment is needed for you, you will get it from here. So this is one of the largest training and research institution in Saudi Arabia. So it is a well known hospital in Saudi Arabia, and also it is under accreditation of magnet from United States of America. So we are undergoing the accreditation, standardized accreditation from United States of America. It is called magnet accreditation. Maybe most of the faculties knows about this one. Magnet is a standard nursing care providing for the patients. So we are looking for that. We are working on it. So more than 3 years we are working about the magnet standard to achieve the goal of the magnet accreditation. So today topic, so it is one of the most important topic for the faculties as well as the students, because you are working in the clinic, you are going to work in the clinical field, especially when you go to the clinical field. So you have lot of questions, you have lot of doubts, why I am following this procedure like this. So we have lot of doubts and questions from ourselves. So we wanted to solve these questions through the evidence-based practice in nursing. Okay, so this is my topic today. So you are going to learn many things today. If you have any clarification, so you can able to ask me at the end of the session. So I am very clear to you. And at the end of the session, we are having 10 minutes for the question and answer. So you will be asking question. I'm going to explain whatever the answers. Okay. So this one is very useful for the student nurses as well as the staff nurses, and also the those who are working in the colleges or faculties in the nursing field. So this is my outline. So you can able to see here. So definition of research and evidence-based practice and the steps of evidence. So when you go back to the steps, we have the different steps in evidence-based practice in nursing, and formulating how we are going to formulate the question. As I told you, when you go to the clinical area, you have lot of questions. Why I'm doing this procedure like this? Why I can able to do in a better way? So we have lot of questions. I wanted to explain to you how we are going to formulate the evidence-based question. The fourth one is that there are different levels of evidences based on the research findings or research methodology. I'm going to explain to you what are the different levels. There are different levels are there. Which level is better level we can able to take from the research articles. So I'm going to explain to you. And we have something called evidence-based practice pyramid. I'm also going to describe what all are the different pyramid is saying. And the last one is the benefits of evidence-based practice as well as the barrier of evidence-based practice in nursing. So this is on the whole the evidence-based practice I'm going to talk about. I'm going to give you an example. I'm going to give you more examples related to wound care nursing. As all of you know, their wound care is our duty, our nursing care. So whenever there is a wound, we are the one involved more on wound care. So I'm going to give you an example how we can able to make related to wound care, dressing, wound care cleaning, all those things. I'm going to give you an example so that it is easy for you to understand about the evidence based practice in nursing, about the wound care nursing. So this is barrier, already I told you. So these all are the objectives we can able to see here. These all are the objectives we can able to learn at the end of the session. So this webinar, the participants will be able to, so all these objectives I'm going to define the research and evidence based practice because it is interrelated. So you should know. So I'm going to define the research and evidence based practice, and also describe the process and outline steps of evidence based practice, and as I told you, how we can able to formulate the question. So it's called PICOT. I will explain to you what is PICOT, what is stands for P, what is stands for I, what is. So I'm going to explain to you what is PICOT, and there are different levels of evidences. What all are the different levels? You should know. So because based on the level only, we are going to take the articles from the levels. Okay. And the next one is then discuss the evidence-based practice pyramid and enumerate the benefits and barrier of evidence-based practice in nursing. So these are the objectives at the end of the session you are going to learn. So as I mentioned, if you have any clarification, if you have any doubts, so you are always welcome because I'm ready to answer your question at the end of the session. Please diligently watch the lecture because it's important for you to understand to apply in your clinical area. Okay, I hope my voice is clear. Madam, my voice is clear.
Yes, sir. Clear, sir. You start
Oh,
to
oh,
share your slides, sir. Share your
slide is
slides.
visible, ma'am.
Yes, sir. Visible. You can share now.
Ma'am, already
The
I'm
slides are
sharing
one by
the.
one. Yes, sir. Shared, but one by one you have to. One by one you
It's
have.
not come.
Now it's okay. Now it's okay.
Because when I put the slide show, it's not
You
coming.
have
I am
given.
not sure. Okay. Now is it okay, ma'am? This is my outline. This is my
Yeah, yeah.
learning objectives.
Yes, yes.
When you go to the introduction, okay, so as I mentioned, when you go to the clinical area, so there are a lot of questions for you. For example, when I went for the clinical duty during my bachelor degree, so what we are doing, we are cleaning the wound with the cotton balls. So how many of you had an experience? Maybe our madam told she's having more than maybe 30, 40 years of experience in the nursing field. Maybe she knows about this one. When I went for clinical duty or clinical practice during my bachelor degree, what I'm doing, I am cleaning the wound with the cotton balls. Now, the research studies are saying that when you use the cotton balls, it is a prone
Sir,
for
excuse me,
infection.
sir.
When you use the cotton
Sir,
balls, these cotton
excuse me,
will
sir.
stick on the wound. It will create the infection for the wound. So that there are a lot of research scholars. They did the
Excuse
study.
me, sir.
They found out that you should not use the. When you have any, as I told you, the students, maybe you are going to the clinical area. So when you have, when you see the practices, each hospital they are practicing in a different way. When you see the practices, so maybe you think that why this hospital is practicing differently, why this hospital is practicing differently. So there is a different practices, you can find it out. Okay, as I told you, when I went for clinical practice during my studies during my bachelor degree, so when I am seeing the wound is cleaned by the cotton balls. Now the research studies are saying that you should not use the cotton balls because so the cotton balls, the cotton material will stick onto the wound and it will create the wound infection. So we don't want to have the infection, or we don't want to have any conflict complication for the wound. So now there are a lot of research studies are saying that the cotton ball you should not use during the wound cleaning. So where we get it? We got it from the research studies to apply the evidence-based practices. So we wanted to fill the gap between theory and practice. There is a theory already, there is a knowledge, we got it from the research studies or research articles. So we wanted to fill gap to the practice. So all the research articles need to be applied in the clinical practice. So this is called evidence-based practice in nursing. So I gave an example. So how we can able to apply it. Okay. Now we can go for the definition. There are different definition. Let us start with the nursing research. All of you know that nursing research means we are researching, searching. For what purpose? We are researching. Every now and then we are searching for the new knowledge, for the new idea, for the new technique, for the new procedure. So all these things we are searching. You see here how we are searching. We are searching systematically. We are not simply searching. We have the research proposal, we have the research method, we have the research design, we have the population, we have the sample size, we have the formulas, we have the analysis, we have the recommendation. So all these things systematically and assessing of nursing problem or phenomena. There is a nursing problem or phenomena. So what we are going to do is we are searching to get the idea, to get the new knowledge, to get the new research, new skills, new technique from the research studies. Okay, this is about the nursing research. Okay, so you can see the next definition also: finding ways to improve nursing practices and patient care through the creative studies. As I told you, why we are doing research studies, why we wanted to do the research studies, because we wanted to improve the clinical practice. So whatever findings, whatever the research findings, we wanted to apply in the clinical area, we wanted to apply in the nursing practices, we wanted to apply in the nursing theory. So this is what we are doing it as a nursing research. So this is called what? The research. When we go to evidence-based practice, as I told you, evidence-based practice and research are interrelated. Without research, you cannot apply. You cannot apply the evidence-based practice in nursing. You can able to see here, evidence-based practice in nursing involves providing holistic. As you know that holistic means it is a complete physical, social, psychological or spiritual, all these complete care, quality care based on the most updated research and knowledge rather than traditional method, advice from colleagues or personal beliefs. So as I told you, so when you wanted to apply the clinical practices, the updated one, so you need to go through the research articles. What is related to wound management material? So what is the updated wound management material is there? So maybe we are using different material. So what is the updated material? So you need to go back to the research studies. You need to find it out what is the updated research, so that we can able to fill the gap between theory and the practices. Okay, so that you, when you apply the theory into the practice, what we can do it, we can improve the quality of care for the patient. When you improve the quality of care for the patient will be satisfied. The patient satisfaction become improved, and also our satisfaction as a nursing staff satisfaction also will be improved. Instead of patient will stay for 1 month, the patient will be discharged within 3 days, because you are using advanced technology, advanced wound material. Because of that, the wound healing process will not be delayed. It will be the wound healing process will be soon, so the patient can be discharged. So this is called evidence-based practice in nursing. Okay, the second one you can see here, the nurses can expand their knowledge and improve their clinical practice. As I told you, when you apply the advanced evidence-based practice in nursing, you can improve your clinical practice. You can improve your experiences, so that what we can do it, you can apply the recent and the related nursing research. You can able to improve your clinical practices. Okay, this is about the evidence-based practice in nursing definition. And also we have another definition also. So as I told you, it is to doing what works and doing it in a right way. So maybe you think that, am I doing it the right way or wrong way? Maybe your clinical instructor will say, no, this is not the way to do this procedure. You need to do it in a correct way. So this is the way you need to do it. So where we get the technique, it is technique. The technique is coming from nursing research. we need to apply in the clinical area. So what we can what will happen when you apply the recent articles in the clinical field? We can able to improve the patient outcome. That means the patient the quality of care will be increased, and also the patient satisfaction will be improved also. So already I told you. So what is evidence based practice? It is a integration of best research evidence with the clinical expertise and the patient value. So we need to integrate the best research, that means the recent research and reliable research articles, and also the best one. So we need to include it in the clinical practice, so that we can able to solve the problems. We have clinically, we have lot of problems. Okay, each hospital, as I told you, each hospital they are practicing differently. Each when you go to United States, they are practicing entirely different. When you go to United Kingdom, they are practicing differently. When you go to Gulf countries, it is practicing differently. When you go to India, the practice is entirely different. So we wanted to unify it. We wanted to use the advanced technology and technique. Okay, so this is the one to have to fill the gap between theory and practice is called the evidence-based practice in nursing. Okay, let's give you more examples on wound. Okay, so as I mentioned, okay, you can able to see here, this is the cotton balls. All of you know that the cotton balls is a traditional methods. We were using long time the cotton balls to clean the wound, right? But now you can see here there are lot of materials are there. You can see the materials like traditional methods. You can see here we can use the cotton balls and also gauzes. This is the traditional methods. But when you go to the advanced methods, there are different methods. We are using now films and foams, hydrogels, hydrocolloids, and bioactive dressing. These all are the advanced technology. You will see here. These all are the advanced material. Each wound it is different. When you go to burn wound, it is different from other wounds. When you go to diabetic wound, it is different. So you should not use the cotton balls or gauze pieces to clean the wound. So where you got it from? This material. So it is from the research articles. Okay. Okay, wound care dressing. This is also important. This is also, you can see here. This is an example as I mentioned. Okay, this is an example I mentioned already. I mentioned an example. You can able to see here. These all are the traditional methods. You can able to see the traditional methods: gauze, plasters, bandages, and cotton wools. These all are the traditional methods. Now we are not using any more gauze, plasters, bandages, and cotton wools. Instead of all these traditional method, we are using biometry materials. Okay, biomaterials are there. Okay, you can see the biomaterials. Okay, and also you can see the fibers, films, and hydrogels. All these material, we are using an advanced material to clean the, to dress the wound. So not anymore using the gauze, plasters, bandages, and cotton balls or cotton wools. Why it's like that? Because, okay, because research studies are saying you should not use all this material, so that we can able to solve the issue, solve the problem in the clinical nursing field using this material. Okay, instead of using this material, you can use this material. Okay, so this is about the this is about the advanced and traditional method. I hope you understood what is evidence-based practice in nursing. I hope you understood where you got the information, because the research studies. We are looking for research studies. If there is any problem, if there is any question, so we need to go back to the research studies to collect the data, to collect the material, to collect the articles, so that we can able to solve the clinical practice issues and problems. Okay. Okay, and also I have another example. I have another example. You know that when you're cleaning the wound, okay, when you're cleaning the wound, the olden days they are telling that you need to clean from outer to inner. or you need to clean with the circular motion. How many of you read about this one? I don't know, but when I studied, my our practice entirely different, because the olden days the practices are entirely different. So they are telling that you need to clean the wound from outer to inner, or you need to clean the wound with the circular motion. But now no more, okay, no more. How we can clean? Only one stroke, okay, one stroke from inner. That means, okay, clean. You need to clear the clean area to unclean area. You need to clean the wound. So this is very important. Only one stroke, not to clean more and more like a circular motion. No, this is not. Where you got the information? Because the research studies are saying that you should not clean the wound with the circular motion with more stroke, the only one stroke, and also from inner to outer. So this is about to we are solving the issue. I'm right. We are solving the issue, and also we are applying the clinical practice. We are upgrading or applying the new clinical practice into the nursing field. And another thing you can able to see here, another thing I can able to see, I can give you, okay, wound cleaning solution. There are many solutions are there. Antiseptic solutions are there. If you go back, so we have povidone iodine, we have fusidine, we have chlorhexidine. So there are lot of wound care materials are there, but research studies are saying it's best solution to be clean the wound is the normal saline. So when you clean the wound with normal saline, it is more better. The healing process will be more better than cleaning any antiseptic solution. So where we got it? We got it from the research studies. So we are going to apply in the clinical field through the evidence-based practice in nursing. I hope everyone understood what I'm speaking. I'm right. I hope everyone understood. Clear? Okay. Okay, and also you can see, maybe this is new for you. When you go to the chronic wounds, okay, like a diabetic foot ulcer, many chronic wounds, okay, chronic, the wound is not healing for a long time. So we are using something called, I don't know how many of you heard about negative pressure wound therapy. I am not sure how many of you heard about negative pressure wound therapy or back therapy. We used to say vacuum assisted closure therapy, back therapy. So we are using this technology also for the chronic wounds, because the wound healing process will take time, especially the diabetic foot ulcers. So what we are doing it, we are putting the wound vacuum closer assisted therapy. This is giving the negative pressure, okay, giving the negative pressure, and to remove the pressure on the wound, and to remove the exudates from the wound, so it will improve the healing. So we are going to compare with something called hyperbaric oxygen therapy. I'm not sure how many of you heard about hyperbaric oxygen therapy. This oxygen therapy, the wound, especially this is used for the wound healing or wound healing process. Okay, put the patient in 100% oxygen, okay, because as all of you know that when the wound is when the wound wanted to heal, the oxygen is very important, okay. The tissue, the oxygen in the tissue is very important. So that we put the patient in 100% oxygen for 4 to 6 weeks, the healing process will be improved. Okay, healing process will be improved. Okay, where we got it? This is got it from the nursing research articles. Okay, so we will compare the wound vacuum therapy with oxygen therapy, which will be better. Okay, so we will go back to the research study and we can apply in the clinical area. Okay, why do we need? Why do we need the the evidence based practice in nursing? So simply, already I told you, okay, to improve the clinical practice and also the patient outcome. It's very important. You will see here. I hope my slide is clear. So why do we need? You can see here. So we need to have, okay, we need to have the best scientific evidence. Okay, I should not take all the scientific evidences. I need to take the best one, and also I need to take the updated one. I should not go back 10 years or 20 years back and go back and search for the articles, because these articles will be old. Yeah, I cannot take it. I need to take the updated one. I need to take the best one. I need to take the reliable one. So that only I can able to solve the problem, solve my clinical practice problem. Okay. Patient values, already I told you, it's very important. Patient satisfaction is very, very important, because the patient satisfaction, when the patient will be admitted to take the treatment and go back to their home, the patient doesn't want to stay for a long time in the hospital. So instead of staying long time, when you apply the clinical best clinical practice or the best procedure and best technique, maybe the patient can able to go within few days to their home. They will be happy, the patient satisfaction will be improved, the patient value also improved. Okay. Clinical experience, it's very important as a nurses. So when you apply for the new and advanced technology, advanced practices in the wound care or any other field, so you can able to improve your clinical practice or clinical experiences. So this is what we need to apply the most updated research articles into the clinical practice through the evidence-based practice in nursing. I hope everyone understood until now. My explanation is very clear. If you have any doubts, as I told you, you can ask at the end of the session. Because of the online webinar, I cannot able to interact with you. So if I am face to face, it is easy for me to interact with you. But I am not. As you know that we are doing the online webinar, so that I cannot able to interact with you. So at the end, we will interact as much as possible to answer your questions. Why do we need? Already I told you, provide high quality care. The Providing the high quality care for the patients. Okay. And cost effective. So sure, it is cost effective, because why we are doing it cost effective, because you are using the advanced technology, but reduce the hospital stay. So when you reduce the hospital stay, it's clear that there is a cost effective. Okay. And also, as I told you, the bridges the gap between the theory and the practice. So we are when you apply the advanced technology, when you apply the clinical practice in a proper way based on the research studies, we are filling the gap between theory and practices. Support the need for the stimulates interest in staff development research. So for the staff, for the faculties, and also for the staff nurses, when you increase. This slide is moving. Now I am here in the why do we need, or the slides are moving. We are here to support the need for and stimulates interest in staff development research. Okay. So we can able to improve, and also we can able to motivate the staff and also nursing faculties to do more research related to nursing practices. So because of that, so we can able to put into the clinical practice. Enhance use of evidence in communicating among department. So whenever we have the new studies, new technique, new procedure, we can able to disseminate this information to other departments. And also, as I told you, sure that we can able to, as I mentioned, the cost effectiveness, because the length of the patient stay will be reduced when you apply the advanced clinical practice in nursing. So instead of patient will stay for 1 month, the patient can discharge within a week. So the cost effectiveness will be less. So this is very, very, very important. Okay. And also filling the gap between the theory and practice. So we have the theory already. There are many research scholars. They invented many clinical practices, so it's available there, but there is a gap between the application. So how we can able to apply through the clinical evidence based practice in nursing? Whatever the research articles are there, just synthesize, analyze, and you can able to apply in the clinical area. So that for this, we are going to fill the gap between the theory and practices. And also for the evidence-based practice, when you use it, when you use the advanced clinical practice in the nursing field, so we are promoting or we are motivating the nursing research and also the staff development, the nursing staff and also the clinical staff and the faculties. They can increase their nursing research when they apply the clinical practice, advanced clinical practice. And also there are different there are different specialty research studies are there. When you apply with the different departments, so that we can able to enhance the advanced knowledge and skills in the nursing field, and also sure that we can able to increase the job satisfaction of the nurses and also job satisfaction of the employees in the in the hospital, as well as the student nurses also. They can able to improve their clinical practice, they can able to improve their job satisfaction in the nursing. Okay, this is very very important, because whenever you wanted to do any evidence based practice in nursing, you must follow these steps. Okay, these are the steps to follow. Whenever you have the research studies, you have the research articles, but what I wanted to apply this one to the clinical area, make sure that you are following these 5 steps. There are 5 steps are there. The first one is the ask questions. So how you can ask the questions? So you can ask the questions to the clinical practice. For example, I'm giving an example. Why I'm using the cotton balls instead of, there are a lot of this lot of advanced wound dressing materials are there. So why I am using cotton balls? Is it appropriate one? So there are different clinical question you can ask. Okay, not only the cotton balls. So you have lot of clinical questions are there in your clinical area. So when you go to the clinical area, if you found why I'm using this one, worldwide they are using the different practices. So you need to ask the question based on the clinical scenario. So this is very very important, based on the clinical scenario. Why I'm using like for example circular motion, why I'm not using the one stroke method? So this is the question you will ask. Okay, so once you ask the question, so you have to acquire the evidences. Where we will get the evidences? From the research articles. Already I told you, when you search for the articles, please go back for 3 years, not before that. So it's very important to search for 3 years of clinical or the research articles related to particular question. So this is, as I told you, you are going to ask the question related to wound dressing material. You will go back and search the articles. What are the different clinical what are the different the wound dressing materials are there in the wound dressing materials are there in the worldwide using. Okay, it's very very important, very very important to acquire the evidence. The acquiring evidence from the research articles, that is also, so that is also from the clinical field of experiences. As I told you, so go back and read the articles, which one is the appropriate one. All these things you should understand. Okay, then appraise the evidences. How you can appraise? You should not take all the things, you should not take all the evidences. So appraise it, which one is best. So I'm going to explain to you, there are different levels are there, there are different levels are there. So which one we can able to take, and I'm going to explain to you. So the next one is the appraise the evidences. You need to appraise it. Okay, so whatever evidences you have collected, whatever the articles you have collected, so what you are going to do it, you need to appraise the evidences. It's very 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 important to appraise the evidences. Then whatever you appraise it, so what you are going to do it, you need to apply it. Where you will apply it? you will apply in the clinical area. You will apply to the patient. So then after application, so you are going to assess the result. You are going to assess the results. Okay. So these are the steps you are going to apply in the evidence-based practice in nursing. I hope you understood this step. First one is the asking the question. What questions? So whatever the clinical practices question. So make sure that you are asking the question appropriately. You are asking the question appropriately. Like, so is it cotton? When you do any clinical practices, you start to think about, am I using a correct technique? So these things, it is important for you to understand asking the question. The second one is the acquire evidences. You need to acquire the evidences. As I told you, the acquiring evidences from where? So from the research articles. Okay. So acquiring evidences from the research articles. Okay. So the research articles, when you are going to take it, mostly you have to take within 3 years and reliable and also the best one. Okay. So the third one is the apprise. Okay, you need to apprise it. Okay, so you need to apprise. When you wanted to apprise, I'm going to explain to you what all are the research articles you can take it, or you can neglect, or you can reject. Okay, and then apply the evidence. Whatever the things you have, you got it, you need to apply the evidence. The last one is the assess the result. Okay, using outcome measures. So you are going to assess the results. So these are the 5 steps you are going to apply in the evidence-based practice in nursing. Okay. Okay. Already I told you the framing the question. It's very, very important for you to frame the question, because the first step is the asking the question. So asking question, when you wanted to frame the question, you need to know what is PICOT. Okay. PICOT. PICOT means P for a population or patient. Okay, P for a population or patient. Either it is a population or either it is a patient. Okay, so maybe when you wanted to apply the wound dressing material, so it's the population is the patient. You can apply the wound dressing material to the patient only. Okay, intervention. So what is the new intervention you are going to use it? What is the new intervention? As I mentioned, there are 2 types of material. There is a traditional method, there is an advanced method of wound dressing material. So I'm going to intervention like foam. I'm going to use the foam wound dressing material. I'm going to compare with the gauze. I'm going to compare with the gauze. Okay, so this is the advanced technology. What is the intervention I'm going to use it? The comparing with the gauze or cotton balls, you need to decide yourself. Okay, then outcome. So after application, maybe 1 month. Okay, this is the time duration. Okay, comparison outcome after 1 month. I put a time duration to apply this new material for 1 month or 2 months or 3 months, whatever it may be. It is based on your intervention. After that, what I'm going to do it, I'm going to assess. I'm going to see the outcomes, whether the wound is healing. Okay, the healing process are improved. Instead of 5 months or 6 months wound, the healing, maybe it will heal within a 1 month. Okay, so that the healing process will be increased. This is called PICOT. Okay, so you should remember, P is the patient or population. So it is based on your application of an evidence-based practice in nursing. You can able to take. And the second one is the intervention. What is the new technology? What is the new technique? What is the new procedure? What is the new material you are going to use it? So you are comparing with old method. You are going to compare with old method and outcome. So after application for 1 month or 2 months or 3 months, based on your study, based on your application of evidence-based practice, you are going to see the outcome. You are going to see the outcome of the patient outcome. So this is the time duration. The time duration, it is based on your study. Maybe it will be 3 months or 6 months or 1 year. So it is based on your study. I hope everyone understood how to frame the question. I put an example. I put an example. Okay, so you can able to see here. Isabel is a 45-year-old woman who asked you for advice on chronic diabetic wound healing with wound vac therapy method. She is particularly interested in whether she would gain any benefit from hyperbaric oxygen therapy. I put an example, you can able to read it, like Picot. P is the, as I told you, P is the patient. Okay, P is the patient. Okay, 40 plus year old woman with diabetic foot ulcer. Intervention. What is the new intervention? I'm going to use it. Hyperbaric oxygen therapy. I'm going to compare with wound vac therapy. I'm going to compare with wound vac therapy with the new therapy that is called hyperbaric oxygen therapy. So the outcome is the wound healing process. Whether the wound is healing within 1 week or within 1 month when I use the hyperbaric oxygen therapy comparatively wound vac therapy. The question is, how does the use of hyperbaric oxygen therapy compared to wound vac therapy in treating diabetic foot ulcer in middle-aged women? This is the question I have it. Okay, I'm going to compare the with wound vac therapy with hyperbaric oxygen therapy. I hope this example is suitable for wound healing process or wound healing therapy. Okay, I hope this is very easy to understand. I put the example. Okay, I hope until now it's clear. So there are level of evidences. It's very important. The level of evidence are assigned to study based on the methodological quality of their design, validity, and applicability of patient care. You should not take all the research. When you search for it, you will find 100,000 research, okay, or 1,000 research. So I should not take all the research. I need to segregate because which is needed for me. So I cannot take more than before 3 years of research studies. I should take only the 3 years. That is also which is reliable for me and also which is best for me. So you need to take it. That is called synthesize. Synthesize. That is called synthesize. Okay. When you collect all the articles, I'm going to synthesize it. Okay. So that's what the steps is saying. So once you collect the articles, you are going to analyze the articles. Okay. So we will see what are the recommended articles you can able to take it. Okay. There are level A, there are level B, C, and multi-level. So you can see here, level A means what? Randomized control trial, RCT. We used to say RCT, randomized control trial. Okay, that is the best research studies you are going to take it. When you collect all the studies, you need to synthesize which is the RCT. Which is the RCT? You will take higher priority to take it. Okay, that is called level A. Level B is the evidence is obtained from quality designed controlled trial without randomization. It is also controlled trial but without randomization. So without randomization also it's called level B. Level C is gets implemented when there is a limited information. So this is not much useful for us when you have the limited information in the research articles. So that it is not important to take level C and multi-level. Okay, multi-level is usually applied to complex cases and gets its evidence from more than one or more other levels. So it's a multi-level. So it's more than one level. So you should not take all these studies. Better to take level A and B. Level A and B is the topmost priority. When you collect all the articles, so you search for it, which is the randomized control trial, and also you should take the quality design control trial without randomization is the best study. You will take it and apply it. Okay. Then you can see here another level also. It's the same as you can able to see here. There are according to John Hopkins in the year of 2010, they level according to the level 1, 2, 3, 4, 5. There are 5 levels. Okay, so as it's the same you can able to see here. Level 1 is the meta-analysis of randomized control trial. This is the best one. That's what it is given as a score, level 1. Level 2 is the quasi-experimental study. So if you know the research designs, there are different experimental design and quasi-experimental design. This is level 2 is the quasi-experimental design studies. You can able to take it. Level 3 is the non-experimental or qualitative study. Level 4 is the opinions, like expert opinions are saying about one topic, and fourth is the opinion of individual expert based on non-research evidences. So these are all the things are not important for us, but level 1, 2 and also 3 is the most important, but you can take. So first priority is the level 1. Okay, first priority is the level 1 because it is randomized control trial. It is the meta-analysis. It was analyzed well, and it is meta-analysis, that is called RCT, randomized control trial. That is also experimental studies. You can take it. The next level is the quasi-experimental. It is comparatively level 1. The level 2 is the level lower level. Okay, so that the first level is the RCT, randomized control trial. The second level is the quasi experimental studies. Okay, this is the according to John Hopkins 2010, they level the evidence based practice in nursing. The next one is the evidence based practice pyramid. So it's very, 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 very important. You will see here there are different color codes. There are different color codes. The first top priority is these three. Why these three? You can see here, you can take practice guidelines. Practice the CPG. We used to say CPG, clinical practice guidelines. Okay, clinical practice guidelines, meta-analysis, systematic review. So this is very, very important because you can able to see here, this is the higher quality studies. Why? Because this is the filtered information. So there are a lot of studies they analyze. There are filtered information from these studies. Okay, you can able to see here practice guidelines, meta-analysis, systematic review is the on the filtered information. These are all the filtered
Make it
information. This
fast,
is the higher
sir. Excuse me,
quality of
sir.
studies. Okay.
Make it fast, sir.
Yeah, yeah, yeah. Only 5 minutes, ma'am. I will
Excuse
finish.
me, sir.
Okay. Hello.
Make it fast, sir.
Yeah, yeah. So this is about the evidence-based practice pyramid. So this is the filtered information. This is the unfiltered
In a
information.
few minutes.
Whenever you wanted to take only the filtered information. So what is the benefits? What is the benefits? As I mentioned, you can able to see the promote positive patient outcomes. Already I mentioned the patient satisfaction and also the patient outcome will be improved, and cost effective. Already I mentioned cost effective because we can able to prevent many complication, because when you use the advanced technology, advanced thing, so we can able to prevent complication and contribute to the growth of the science of nursing, and allow for incorporating of new technology into healthcare practices. Okay, then increase nurse autonomy and confidence in decision making. So these are all the benefits of evidence based practice in nursing. And also this is about the ensure relevancy of nursing practice with new intervention and care protocols, and scientifically supported. Also when you have the research, we can able to support scientifically, and as you know that it is one of the decision making process. Okay, when you wanted to make any clinical practice question, we can able to make the decision, and the staff can able to think critically. And also, so this is lifelong learning. So when you wanted to learn, read the article and apply in the clinical area. So it is for you to understand that thing. So barrier, there are different barriers are there. Sometimes when you search for some articles, you will not find. That is called lack of research articles and lack of knowledge, especially the nursing field. So there is the different, the knowledges are very less related to evidence-based practice. If you go and ask even the faculty of nursing, they doesn't know about the evidence-based practices in nursing. So what we need to do, we need to enhance their knowledge and skill related to evidence-based practice. Lack of time to read, as nurses are very busy in doing duty, so it is a lack of time to read and evaluating. And staff resistance, sometimes when you ask them to apply the clinical, no, the evidence-based practice in nursing, they are resistant in the nursing field. Okay, so this is my conclusion. I wanted to conclude. So as I told you, so this is one of the problem solving and the clinical making, decision making approach. And evidence-based nursing integrates clinical expert with the best external clinical evidences and enhance the staff satisfaction and also patient satisfaction. I wanted to conclude it's very important. If you have knowledge, is not a power, but you need to apply in the clinical area. So the implementation is the power. So if you have knowledge, so you will keep it in yourself. So it is not okay. It is not the power, but when you apply in the clinical area, it is the power. Okay. Thank you so much for inviting me, ma'am. Thank you for all the participants and also the faculties. Really, I'm very grateful and pleasure to have this session. And I hope to see all the students are well versed of evidence-based practice in nursing. When they go back to the clinical area, make sure that they are applying the advanced technology and advanced material in the wound dressing, not to wipe with the gauze or the cotton balls, because it will create the complication for the wound. So I hope everyone to apply the evidence-based practice in the clinical area, especially for the faculties, when they are teaching the students, especially when they wanted to take any topic, they will search for something new, like what the articles are saying about this topic. So they can add each topic related to advanced technology. The students will complete their course when they got the opportunity to go back and work in abroad. So what they can able to find, oh, my faculty or my teacher, my lecturer, my professor told about this one. Oh, I can see this one. I saw this one. So this is very important for the faculties and also the students. So make sure that your college and your principal, in coordination of the respected principal and respected vice principal, all the faculties can add the research studies in each topic. What it is saying about this topic. They can add the advanced technology in the topic, they so that the students can learn many things in the research and evidence based practice in nursing, ma'am. Thank you so much. This is my references. If you wanted to go back and read it, you can able to read it from these articles and also the material. Thank you so much for listening. Thank you all.